So this is my audience. Right there. Right there and right there. I got her.
Right here.
So, my speech is about tattoos. I'm teaching you because you want one. And I'm teaching all you because you might get one. By Riley. Tattoos are the newest it thing among people between the ages 18 and 30. 25% of this population have at least one tattoo. And then within the next few years, it will become 40% of this age group. But did you know about the different infections or problems that can arise from tattoos? I will try to inform you in this 5 to 7 minute speech on how tattoos are done and dangers of tattoos, tattoo infections, and how to choose a shop if you're still interested in receiving one. A tattoo is a permanent mark or design made on the skin with pigments inserted through pricks into the skin's top layer. The tattoo artist uses a handheld machine. This is a handheld machine. With one or more needles that pierce the skin repeatedly. With every puncture, the needle inserts tiny droplets. The process of tattooing can last up to several hours for large tattoos with no anesthetics. Tattooing can cause small amounts of bleeding and slight to potentially significant pain. With getting tattoos comes a risk for infections, allergic reactions, bloodborne diseases, and even complications with medical equipment. Allergic reactions. The tattoo dyes, especially red, can cause allergic skin reactions resulting in an itchy rash at the tattoo site. This may occur even years after you get the tattoo. This tattoo is reddened. Other skin problems, sometimes bumps called granulomas, form around the tattoo ink, especially red ink. Tattooing can also lead to raised areas caused by overgrowth of scar tissue, keloids. This is a granuloma, well, a couple granulomas. And this is keloid, the buildup of scar tissue.
That's gross.
And this is cellulitis with MRSA. Bloodborne diseases. If the equipment used to create your tattoo is contaminated with affected blood, you can contract various bloodborne diseases, including hepatitis B, hepatitis C, tetanus, HIV, the virus that causes AIDS. MRI complications rarely happen to tattoos or permanent makeup. May cause swelling or burning in the affected areas during the MRI exam. In some cases, such as when a person with permanent eyeliner has an MRI of the eye, tattoo pigments may interfere with the quality of the image. This is an MRI burn. By using unsterile tattooing equipment and needles can transmit infectious diseases such as hepatitis. The risk of infection is is the reason the American Association of Blood Bank requires 1 year wait between getting a tattoo and donating blood. It is extremely important to make sure that all tattooing equipment is clean and sterile before use. Even if the needles are sterilized or never have been used, it is important to understand that in some cases the equipment that holds the needle cannot be sterilized reliably due to its design. In addition, the person who receives a tattoo must be sure to care for the tattoo properly during the first week or so after the pigments are injected into the skin. The FDA urges consumers and healthcare providers to avoid any adverse reactions to tattoos, permanent makeup, problems with removal, or adverse reactions to temporary tattoos. Consumers and healthcare providers can register complaints using the contact information in your guide to reporting problems to FDA. If you're still thinking about getting a tattoo, remember that getting a tattoo is permanent. Tattoo is an invasive procedure that requires breaking of the skin and coming into contact with blood and body fluids. Make sure the studio is clean like a doctor's office. A hint is check the bathroom, and if it's dirty, get out of there. Check the artist's business license to make sure it's up to date, and check the tattoo area. Look for separate areas for tattooing with clean, hard surfaces with no random items containing the work area. This would be a clean tattoo surface. No areas contaminating it. Ask questions like, is there an autoclave? Are needles and other materials single use? Are EPA approval disinfectants used? Do the tattoo artists wear gloves? Professional artists don't mind questions. Watch the artist and pay attention to the health and safety precautions. Watch the artist open all needles before beginning work. And here's some do's before you go and get a tattoo. Don't drink alcohol or take drugs, especially aspirin, the night before or while getting the tattoo. Don't get tattooed if you're sick. And while you're there, make sure the needles are removed from a sterile single-use package before use. Make sure the studio has sterilizing equipment to clean instruments after use, like the autoclave. Make sure the artist washes his hand before he puts on sterile gloves. Many tattoo artists require to take training on prevention of bloodborne pathogen illnesses. Make sure the work area is clean of non-sterile objects like water bottles, purses, a cell phone, any of those things. Get a list of specific pigments used, including color, manufacturer's name, and lot number. After getting a tattoo, carefully follow healing instructions, including the use of antibiotic ointment or anything that the tattoo artist tells you to use.